Hi, our group will be presenting electrocardiography ECG. This is our group members. I will be presenting the theory behind ECG. The ECG records electrical activity originating in the heart from the surface of the body by attaching 10 electrodes to the skin, 4 on the limbs and 6 on the chest. The standard 12-lead ECG records 12 leads, including 6 frontal leads by using 4 lead electrodes and 6 transverse leads by using 6 chest electrodes. 6 frontal leads provide information about the heart's vertical plane, and 6 transverse leads provide information about the horizontal plane of the heart. Next. An ECG can be used to measure the changes of electrical activity of the heart in each cardiac cycle. The heart contains autorhythmic cells that will spontaneously generate cardiac potentials and cause depolarization of the SA node in the right atrium. Atrial contraction will happen in response to electrical depolarization of the atrial muscle cells, and this produces the P wave in the ECG. After that, the SA node will generate an electrical impulse that travels through the atria to the atrioventricular node. The wave of depolarization then spreads down through the bundle of His, reaching the top of the septum. Bundle of His is divided into right and left bundle branches, and Purkinje myofibers is expanded into left and right ventricles, and ventricular depolarization happens, resulting in the QRS complex in the ECG. Then, ventricle will relax in response to electrical repolarization and generate the T wave in the ECG. Next, I will be passing on to Kaizhong.
Okay, so I will talk about the clinical application of ECG. The ECG may provide us with a great variety of information about the heart. The doctor may learn a lot of the status of the heart by looking at any ECG anomalies and establishing. It offers information on cardiac contraction rate, rhythm, and pattern. It will show a sign of the patient's sickness. It is used to identify cardiac illness such as coronary artery disease, myocardial infarction, hypertrophic cardiomyopathy, heart enlargement, irregular rhythm, and heart inflammation. After the patient has used drug for the treatment of the heart disease, ECG can observe the change that occur to the patient. It's a useful equipment to observe on the critical sick patient and patient who is having a stress test. For patient with heart disease, this equipment can be used to check and track the patient heart condition. For the patient who has implanted a pacemaker, is able to see how the pacemaker is working on this patient. Overall, ECG is a screening device for the identification of illness and the implementation of disease preventive programs. So I will pass to Kai Wen.
Now I will present about the innovation and challenges in solving biomedical problems. The standard ECG is already available for more than 7 decades in the clinical practice, which makes it attractive for big data analysis algorithms. That is, millions of ECG are recorded worldwide. This vast amount of digital ECG data enable us to detect disease or potentially diseased heart just from the ECG. Next. The major challenges of the ECG is the ECG lack data consistency check, especially in ECG waveform evaluation based on the morphology. The main factor that influence the ECG waveform are electrode position prone to human error. Next. Traditional method to limit the placement error of this lead is to train the worker to position the electrode in the precorder region as standard electrode position. Next, in order to improve the standardized output and diagnostic value of electrocardiogram, 3D camera had been used to locate the electrode on the chest. The camera can make reliable patient-specific diagnosis because it can enable the localization of the electrode, but also position the human body. The figure on the right is the example of a 3D camera image with electrode position. Next, I will pass it to Rosemary.
Next, we will discuss the further improvement of ECG in the following time. The future trend of ECG can be improved in many different ways, like interior function, exterior look, and so on. For example, improve the ECG diagnosis to enhance the gentle and disease-specific analysis, which the current ECG cannot differentiate. Second, to simplify the operation to popularize ECG in public. Modify the ECG operation, make it easier to handle, and explain the result in more detail for the non-time-space user to read. Last but not least, add the LED projector to guide the accurate electrode placement. Since the most possible error prone to human error, that wrong place of the electrode by the physician. Adding an LED projector can measure the accuracy and consistency of the result. Next will be the reference for our video. Thanks for watching.